Today, I'm talking about one of the most common problems I see in my knee clinic. That's meniscus tears or meniscus pain. You've probably heard conflicting advice such as just rest, it'll be fine, or do strength training in the gym, or you need an operation. The truth, meniscus tears are rarely just a tear. It's a sign that your entire knee ecosystem needs attention. I'm Dr. Arj. I'm a knee and hip orthopedic consultant in London. I'm the founder of Ortholongevity, and my mission is simple. It's to keep people in their knees and their hips and their joints healthy for decades, not just fix short-term pain. So today I'm going to walk you through my 5-step Ortholongevity Plan. It's practical, it's proven, and most importantly, it works for real people in real life. Let's begin. So what actually is a meniscus and what does it do? Well, if we look at our knee model, we've got the top bone here, the femur, that's the thigh bone, the kneecap, which is here. So that's looking at the knee from the front, that's looking at the knee from the side. This is the shin bone, and the meniscus, if the knee bends like this, so the knee's bending, the meniscus is the squidgy tissue in the middle of the knee. I'm just going to open this knee up and show you. So that's the meniscus, the C-shaped ring of cartilage. There's 2 of them, there's one here and there's one just on the other side of the knee as well. So 2 of them shaped like C's, wedged in between the 2 large bones in your leg. So wedged between the thigh bone and the shin bone. They're not just shock absorbers, they're actually high precision engineering by whoever designed us. They're really clever. They're made of a strong substance called fibrocartilage, and that's different to the cartilage that's stuck on the end of your bone in your knee. So that cartilage, which is stuck on the end of your bone here, this is called hyaline cartilage. This is what can get damaged or gets eroded away in osteoarthritis. The meniscus cartilage is called fibrous. So what it does, it helps the round end of the femur bone fit properly with the flat end of the tibia bone. So again, back to the knee model, the femur bone is quite round on the end and the tibia bone is quite straight, so they don't match very well. So the meniscus is wedged between them and stops uneven movement or translation. It's a bit like when an airplane lands on a runway, and to stop the plane from moving forwards or back on the runway once it's parked, these sort of triangular chock blocks kind of get wedged onto the plane wheel by the ground staff. So the meniscus is really similar. It kind of keeps stability between something that's spherical and something that's flat. They also, by doing that, distribute pressure in your joint more evenly, so distribute load to the cartilage below, which is the hyaline cartilage, and that cartilage covers the bones, so they dissipate force or spread force evenly to the cartilage and the bone in the knee. They help lubricate the knee, they help guide motion, they help with stability, as I've said, and they also feed information to your knee about what position you're in. So that's called proprioception. So that's via some nerves that are in the edges of the meniscus are really important. They have blood vessels and a blood supply and nerve endings. The central and front parts of the meniscus don't have any of that, but the edges near the capsule of the knee have these nerve endings that mean they understand where you are in orientation and in space, meaning when you're twisting and turning or trying to jump onto something, you've got your coordination and balance. So they're really important for that. When a meniscus can tear, or if it starts to become degenerate, sometimes as we age, what it's made out of changes, so it's less firm and rubbery and become a little bit weaker and more jelly-like. If it splits or degenerates or just injures in a sporting injury, the shock and load going through the knee increases significantly, and you can get wearing away and pain in the knee. That's why a meniscus injury needs to be treated fairly urgently, and it's important we understand how to treat not just your knee but also all of you, so we can reduce the inflammation that happens that's associated, and also the load forces going through the knee. So it's not just about repairing the knee or fixing the meniscus tear, it's about trying to prevent it happening again and reducing the chances of further injury. So why do these happen? There's 2 main reasons. They're either traumatic, so this traditionally is when we're a bit younger and the meniscus is stronger. So either when we're a child or an adolescent or a younger adult, because the meniscus tissue is in really good health and it normally only tears when you have a pivoting or rotational injury, or an injury where the knee bends a lot and there's a lot of force going through it. So that's if the knee bends a lot like that, you can see that the femur bone and the tibia bone are really squeezing that meniscus in there so it can split. And that could be if you do a deep squat or kneel down and you're right on your haunches or your bum is almost touching the floor. So deep squats and deep flexion of the knee, I feel, should be avoided where possible. The other scenario is if you twist the knee. So if the knee twists, again, you can see the bones kind of squeezing on the meniscus as you rotate. So often if you do pivoting sports like football or tennis or netball or skiing, you can sometimes get a meniscus tear or injury. Degenerative tears, the other type of tear that tend to occur with less force, and that happens to us when we're a bit older, typically, normally over the age of 40. And I can comfortably say that because I'm nearly 49. The meniscus is a bit weaker, it's a bit more brittle, less vascular, so more prone to tearing with simple movements. And sometimes people just get pain in their knee and they haven't really done much to aggravate it, and it often can turn out to be a degenerate meniscus tear. So what's the 5-step ortholongevity plan that we tend to use in our clinic to help patients with meniscus tears? So step 1 is move better. So moving better just means removing the hidden stresses that overload the meniscus every single day. Most people kind of walk, they squat, they climb upstairs or come downstairs, or they jump or hop with small misalignments that they don't normally notice. So over the time, these micro imbalances can cause some overload, and that can often cause an injury. Common movements that you might do that we'd help you work on would be that your knees collapse inwards when you squat or when you're walking. And this is something you can have a look at in the mirror. You can practice it if you've got full-length mirror, or if you belong to a gym, there's often lots of mirrors in the gym. You can start to squat down and just see if your knees start to turn inwards. You really want your feet to be about shoulder width apart when you do this. Sometimes when you're playing sports, you may overly rotate the knee without also turning your foot. So if you rotate a lot on a fixed planted foot, it's a lot of twisting force for the knee. So again, some of the ways we twist and move, we can change them if we really think about them, or retrain, and again, that can reduce the chance of a meniscus injury. Sometimes our pelvis can be weaker, so when we try and climb up something like climb up stairs, the pelvis on the side we're climbing, so if we're climbing with our left leg going up the stairs, just watch your pelvis or feel your pelvis. If the pelvis bone starts to drop and you compensate and your knee turns inwards, it means you're putting a lot of force through the knee and through the meniscus. And again, that could be because of slight weakness in muscles further away from the knee, such as on the side of your hip. And a common muscle that can be weaker is called gluteus medius. And we'll talk about that muscle, which is super important, in another one of my videos. It may be that you're born like me with flat feet. So I've got flexible flat feet, which means that when I stand, the arch in my foot flattens, but when I don't stand and there's no weight, it sort of springs back. Some people have fixed flat feet where the arch is always flat. And if you have either of those issues, that can make your feet turn in or pronate. So pronate is a term really commonly used by physiotherapists and podiatrists. So if your feet pronate and drop inwards a bit, then your knees, which are above obviously, can also turn in. And again, that can put force on your meniscus. So a fix for that might be having shoes like I do, which have a bit of a thicker arch in the sole. So I have these Hoka running trainers. I'm not sponsored by them, but they help me when I run because they give me a bit more of an arch and keep my knees stable so they don't turn in when I'm running. And that really helps me with any pains that I used to get. So when you walk, ideally your knee should kind of track over your second toe, and that's how you know you're kind of moving with your knee over your foot. If your knee sort of starts to collapse inwards, your inner meniscus, called the medial meniscus. So just to recap again, there's 2 menisci in each knee. So if I just open this knee model again, you've got 2. So there's one here, that's the inner one. We call that medial, just to confuse you. And the one on the outer is called lateral. So there's one on the inner part of your knee and one on the outer part. So 2 meniscus per knee. If your knees turn inwards, the inner one gets squeezed and then it can tear. So simple things that you can do: turn with your feet or pivot with your feet, not your knee ideally. Avoid deep lunges or squats, as there's no mechanical advantage to doing them. So if you're doing squats, which is super important, I personally don't recommend that you should go below 90 degrees. or where your femur bone and your tibia bone, you don't want to go, that's a right angle, you don't want to go too much past that, in my opinion. And that's how I practice when I'm in the gym. And you want to focus on slow, controlled stair movements as you're stepping up to try and control and think about your pelvis and make sure it stays stable and doesn't drop. So some really easy exercises you could do, or that your physiotherapist or strength coach could help you with if you're not sure, or even your personal trainer, would be wall squats, ankle mobility exercises, and step downs with a level pelvis. So we'll talk about exercises again in another video that I'm making, but you can have a look at those on the internet or on YouTube if you're not sure. So what's pillar 2? That's be stronger. So pillar 1 was move better. This is be stronger. So strength isn't optional, it's so important. It's probably the most important treatment you can have, more than anything else, including things I do as a surgeon, such as knee injections or knee surgery. A stable knee and strong knee helps protect the meniscus from shear forces or compressive forces. Key muscles that you need to target are the quadriceps muscles. So they're the large group of muscles at the front of your thigh. There's 4 of them. They're all important, but the inner one called VMO is the most important, but if you exercise all of them, that's great. Your hamstring muscles at the back of your thigh are also really important. So the big muscles at the back of your thigh. Sometimes people are very strong in their quadriceps, but relatively weak in the hamstring. So what you really want is to try and have an even amount of strength, so there's no uneven pull on the joints. You really want to think about your gluteal muscles. There are 3 gluteal muscles. Most people know about maximus, glute maximus, which is the biggest one. And that's the one that gives you the shape of your bum. And that's important, and you need to work on that. But I would say the most important one is the one below it. So if the maximus is taken off, underneath it is a medium-sized gluteal muscle called gluteus medius. That's the most important one. Exercising that normally involves you moving your hips or your legs outwards, like a clamshell type move, or hip abductor moves that you can do in the gym. And again, we'll go through this in another video properly. That's a very important muscle. Of course, your calf muscles are also really important, and I often find really overlooked. Really important you train those and strengthen those as well. So if these muscles are weak, your knees can kind of wobble around and you can put more force through the soft rubbery meniscus. So what do you need to do in terms of workout? Well, what you need to do is what I do. I wouldn't ask you to do any more. If you've got lots of time and you're very much into the gym and exercise, then you can do this maybe 3 times a week. If you're at the gym or you haven't been for years, or you've got no time. Like me, I've got 4 children. I'm an orthopedic surgeon. I'm fairly busy, but I make time to go at least once a week for 1 hour to work on all my lower body muscles, so anything below my belly button. Well, in fact, I also do my core, so I tend to work on my abs and my lower back with my legs as well. And I can work out on all these muscles within about 1 hour, and that's probably the minimum you need to do, and that's what I'm doing, but it really, really helps. If you can do 2 or 3 sessions a week, great. If you can't, if you can show up and do 1 hour session a week, it's going to really, really help your knee, and also make you really enjoy all the other activities you do. Lots of patients I see in my clinics, they don't really like going to the gym. They either are sedentary and they are not active, or they're super active, but they do lots of other things, like they run a lot, or they play lots of football or tennis or ski, or they do lots of Pilates or yoga or swimming, but they don't like going to the gym and doing strength training. And it's really important that you do that 1 session of strength training at least, and it will feed your other habits and make you better at everything else, make you stronger and keep you injury free and keep you away from doctors or surgeons like me. I would do hip adduction, which sounds like abduction, but one is pushing your legs apart against some pressure or resistance, and the other one is starting with your legs apart and squeezing them in to work the muscles called the adductors on the inner side. Of the other exercises would be a squat or a leg press, and again, as we said, you don't want to go back so much that your chest is almost touching your knees and your knees are bent, a lot. You want to squat or leg press to about 90 degrees, that's fine. I normally do calf raises, which is where you stand on your tiptoes carrying weight, and that helps strengthen your calf muscles. I then also do hamstring curls, which is something where you normally lie on your front and you have something on your ankle and you bend your knee against resistance to work the back of your thigh. And again, I'll show you, it sounds a lot more complicated than it is, but I'll show you that in my exercise video. Lastly, I normally work the core muscles, which I think are important for everything. They're normally the muscles in the middle part of your body. So the ones at the front are the abdominal muscles, and you can do some sit-ups or crunches, or if you're in the gym, you can also do back extensions where you push back against resistance. So it's the opposite of an abdominal crunch or a sit-up, and that strengthens the muscles at the back. So let's move on to pillar number 3, and that's reduce inflammation. So what is inflammation? Well, inflammation is your body's alarm and repair system. Think of it like a home thermostat. Normally, you want the thermostat to be off, so that means no inflammation. But when you need it, you want the thermostat to be on. So when you've got an infection or an injury where you need to heal or stress, you need inflammation. Short-term inflammation is good. It helps you, it heals you, it fights infection and repairs damaged tissue. But here's the issue. Many people have their thermostat permanently on at a low level, and that's called chronic inflammation. It's not high enough to cause you a fever, for you to have chronic low-grade swelling, stiffness, morning pain, lethargy, joint irritation, other effects to your body like your gut. You may be bloated, you may feel sluggish, and low-grade inflammation for your joints is harmful because it damages the tissues like the cartilage, the meniscus. It promotes slow breakdown of them. It degrades collagen, which is a really important building block in your joints, like in cartilage. It inflames the lining of the knee called the synovium, which is the inner skin of the knee, makes it thick and sensitive to pain, and it can accelerate osteoarthritis. So what are the natural ways that we can reduce chronic inflammation or turn the thermostat right down or off? Well, actually, they're things that make sense, but are often in practice really difficult to do. So the first one is sleep. You want to be sleeping well for at least 7 to 9 hours. This is really difficult when you're really, really busy, or if you've got to get up early, or at the moment, like with us, we've got 4 children and we've got a newborn and a 2-year-old. So, it's difficult, right? And when I've got operating lists where I have to be in quite early into the hospital, like 7 a.m, it's hard, but what, I try to get into bed as early as possible. I try to not be too stressed about things, so the quality of sleep is better. It's not always easy. You can see sleep coaches who we work with. You can try apps that I've used in the past that can help you sleep better. You can try meditation, calm thoughts. There's all sorts of ways of trying to get better sleep, which again, I'm going to make a video about that and I won't go into it now, but there's lots of other sources you can look at for that. But definitely sleeping better reduces inflammation, and hand in hand goes reducing your stress. Again, this reduces cortisol levels. Cortisol elevates inflammation in your body, especially when it's always constantly running, because your body becomes insensitive to cortisol. So normally cortisol is an anti-inflammatory, and that's what cortisone, the knee injection, is made out of. But a bit like insulin, which is something that helps you reduce your blood sugar, if you have a lot of it just floating about in your system, a lot of cortisol, because you're not sleeping, you're stressed, your body starts to become more immune to it, and more is needed, and so you get more inflammation. Nutrition is really important. Having a really good diet, lots of colourful foods, fresh foods, so fresh vegetables and fruits. Green coloured foods are really good, like spinach and broccoli. Nuts and berries are great for reducing inflammation. Staying well hydrated. Coffee is actually good for you, and dark chocolate, as long as it's over 70%, can all help reduce inflammation. Fish is very good, especially oily fish that are really high in omega-3 fats. Pulses and extra virgin olive oil, though I appreciate it's fairly expensive, it's a really good oil for you, so you should be having that with your food or cooking with it if you can afford to. Things that promote inflammation are normally things that we call ultra-processed foods, and again, I've got a video on what ultra-processed foods are and how you might be able to eat better, and easy ways that you can try and eat better that are practical. But ultra-processed foods are normally foods that kind of come in a box or a tin and have been altered in a way. So if you look at the ingredients for those foods, the ingredients, you maybe won't understand them because they're not things you'd normally find in your kitchen. So it might be lots of additives or preservatives or E-numbers. And those foods often can make your body react to them, or your gut react to them, and that increases inflammation. And that can directly make your knee injury or meniscus injury hurt more. Using ice therapy is really good for reducing inflammation, and that can be in the form of an ice pack or short-term anti-inflammatory medication like ibuprofen or Nurofen, which is what we call it here in the UK. Again, in the short term, they can be really good at reducing inflammation. So that is pillar 3. What's pillar 4? Well, that's optimized nutrition and body weight. So if we increase our body weight by 1 kilo, the force that goes through our knee is normally 3.5 times that. In particular, through the front of the knee here, where you've got the kneecap bone or the patella and the femur bone, they normally get squeezed into each other, when your knee bends and you put weight on your knee. So when you're trying to step up to go upstairs, a huge amount of pressure goes between the kneecap bone and the femur bone. And every kilo you put on is like 3.5 kilos going through the patellofemoral joint, which is what it's called. In terms of your meniscus, a 5 kilo reduction in your body weight, especially if it's fat more than muscle, will take off hundreds of kilos of pressure from your meniscus for every hour you walk. So you want to eat to support your knee tissue, and that means you need to eat protein. Being a vegan is absolutely fine. There's lots of sources to get protein as a vegan, but we know now actually that some of the better proteins will be found in meat or lean meat like chicken or pork. As I mentioned earlier, omega-3 fatty foods or fat-rich foods are really good for you, like oily fish like mackerel or salmon. Seeds are great. I didn't mention that earlier. Seeds are great, like chia seeds or flax seeds. You can sprinkle them into your food. We've already talked about the benefits of leafy greens, and you want to hydrate. So you drink lots of water, 2 to 3 litres a day. I often have an electrolyte tablet in my morning water. That's not necessary, I have to say, but I do it because I often find I don't have time to hydrate as much as I want to. I think if you're not sweating a lot or working out a lot, that maybe is unnecessary and potentially can cause you to have too much salt. So though I do it, maybe wouldn't recommend it for you, but definitely hydrate with water as much as you don't necessarily need to take any supplements if you've got a good balanced diet, but really important ones that can help you if you think you're low is vitamin D. And again, we'll talk about vitamin D and calcium in another video, but vitamin D is really important for your joint health. Omega-3 is important. Collagen, we've found, can be really useful for you, collagen supplements, and also magnesium and creatine is a supplement, again, I've started taking, which is really useful if you want to try and promote and build some muscle tissue. And again, studies have found that creatine can be very useful for you. And all of that I'll go into more detail in my next video. So what's the final pillar? Pillar 5. So there's 5 pillars for ortholongevity. And again, just to recap, they are to move better, be stronger, reduce inflammation, optimize nutrition, and finally have targeted treatments if you need them from someone like myself, from a knee surgeon. And that could be biological treatments like in certain types of injection or minimally invasive keyhole surgery if you need it. So we talked about some of these injectable treatments in one of my previous videos, which we'll link in the description. PRP in particular, or platelet-rich plasma, delivers concentrated growth factors right into the knee joint towards the meniscus to support fibrocartilage healing, which is what it's made out of, to reduce inflammation, which can cause further damage to the meniscus, to help improve symptoms of pain, to help it function better. It's best for traumatic tears or degenerative tears with swelling, for really active adults and patients wanting to try and avoid or delay surgery. And it's something that I've used a lot more on my patients in the last few years with really great results, where previously I wouldn't have considered it and I would have gone straight to surgery. We now try and avoid surgery, treat with offloading, strengthening, anti-inflammatory, and PRP therapy, and many patients now don't need surgery. And if they do, then we can do the surgery, which normally involves me putting a little camera into the knee and sewing up the tear with some tools. Again, we're going to do a really good video on meniscus repair surgery, what it is, and I'll show you the tools that we use in another video. In terms of meniscus repair, it's a fairly straightforward procedure if a surgeon like me who does it every week performs it, because the more practice you get doing a technique, the better you get at it. We try to repair the tear if the meniscus tear is vascular and has a really good blood supply. If it does, then the chance of it healing are great. If it doesn't, sometimes because some of the meniscus doesn't have a good blood supply, or the tear is very old and you've been waiting a really long time to have your treatment, and sometimes repairing it won't work. We'll sew it together, but it will still split and tear because it won't heal because the tissue is not alive. If that's the case, then we normally remove the torn fragment of meniscus. We don't remove the whole meniscus. That's a very old treatment that used to happen and shouldn't be happening anymore, because that can cause you osteoarthritis. And we try to remove as little as possible. Often it's a very effective treatment and it's called a partial meniscectomy. And in many cases, only 5 to 10% of the meniscus volume is removed. It's much more forgiving if it's your medial meniscus that this happens to. It's a bit less forgiving if it happens to your lateral or outer meniscus, as that meniscus is more important and covers more of the outer part of your knee. When should you have meniscus surgery? That would normally be if you're still having symptoms and the other treatments haven't worked, and also if the tear doesn't look like it's going to be successful to be repaired. I personally normally make that call in surgery. I find it difficult to know with an MRI scan. The MRI scan is really important for understanding, do you have a tear and where is the tear? But often in terms of, is it one to repair or not, I tend to make that call in the surgery. When I put the camera in, we can see the images on a big high definition 4K TV screen, and then we see if there's any blood supply, if the tissue looks healthy. If it looks healthy, we'll repair it, and if it's not, then we'll remove the torn fragment. You only really need the surgery if the piece that's moving around causes you pain, it's unstable, or it might cause what we call mechanical symptoms, which mean that the knee kind of locks or catches because the meniscus tissue, some of it's in the wrong place. If it doesn't do that though, and the pain gets better and your function gets better, it doesn't matter if you've got a meniscus tear, you don't need the surgery. So we just need to use a common sense approach. If you've got really annoying symptoms that are troubling you and nothing else is working, have the surgery by someone who's really experienced at doing it. If you have fairly advanced locking, catching, pain, or failure of improvement in symptoms after 3 months of trying the earlier approach, then we'll start to think about PRP injections or surgery, which normally is minimally invasive keyhole surgery, which is normally a day surgery with procedure where you can go home the same day, you can still walk on your leg and go up and down the stairs. Normally you have crutches for comfort, and normally the procedures in my hand take under an hour. So most meniscus tears can improve without surgery, so don't worry if you have one. If you follow our plan and you move better, get stronger, reduce inflammation, optimize your nutrition, then you'll either start to feel a lot better and get back to all your activities, or if you do all these before you get an injury, even better, you're going to prolong your knee health well into your 70s and 80s and longer. So you're going to be independent, you're not going to need to ask anyone for help, and if anything, as an older person, you can be in a position to help other people. So if you want more surgeon level joint longevity content, please like and subscribe, and then I'll make more videos for you because I really enjoy making them. Thanks and see you soon.